The intersection of policy and technology will very much center on informatics and the way we use information technology in healthcare. For markets to work, for partnerships to work, it demands transparency and accountability. That means a lot of the focus will be on things like decision support, how doctors will be able to get information to make smart decisions that will protect patients, how we automate the electronic health record, how we connect all this together so that what happens down in Miami in an emergency room actually can be accessed here at Centennial or Vanderbilt or St. Thomas Hospital at any moment's notice. And then that fourth area, in addition to automation and decision support and connectivity, is informatics, and that is data mining, how data can speak to data in a powerful way beyond what the human mind can do to figure out what is best for an individual patient. And that brings us into this whole field of personalized medicine. That's the intersection, I believe, of technology and policy that's most exciting and most useful for reining in cost and building value, ultimately improving access to affordable health care for all.
Health IT is the new backbone for our healthcare delivery system. About that, there is little question. In order for Health IT to be fully engaged, we need resources, we need public policy, and we need a good, strong public-private partnership. I think that's possible going forward.
A huge issue that we've got to face in healthcare is the escalating cost and, frankly, some of the quality issues that we have in our system. I just really believe that technology is a key part of the solution to that. I think that policymakers in Washington, in the states, are seeing that as well and beginning to both contribute to and insist on investment in these modern technologies. Technology and IT in particular has transformed so much of American business, and healthcare is just a ripe field for bringing this to bear to provide a better product to the patients in our country.
I see a brand new growing marketplace for products and services born on these three trends that are occurring at the exact same time. The digitization of our healthcare infrastructure with the adoption of electronic health records, the opening up of healthcare data both from the government and from our health systems more generally, and the transition to value-based payment models, combining to create the opportunities for innovators and entrepreneurs to build the products and services for that new healthcare economy. This is going to be a story of public-private collaboration unlike any we've ever seen before, built on a foundation of data and inspired and called into action thanks to the new incentives that will come forward through value-based payment.
As we look into the future, public policy really has to evolve to match up with technology. We believe that technology actually has moved quite a bit faster than public policy, particularly as we look at some of the issues around privacy and how they are viewed in the United States, and how technology has started to push the edges of the envelope in terms of privacy. As we look out into the future, if we are really going to connect the kinds of data sources that we need to in order to actually improve health in this country, we will need to make some changes in our public policy in that particular regard.
This is a really exciting time in health information technology and healthcare. With the advent of meaningful use, there's been incredible adoption, but there's also been a proliferation or development of standards. And those standards make possible a healthcare environment that allows us to move to really support better care for patients, care that's connected across different sites, including the patient's home, care that's connected to mobile devices, care that's informed by decision support to give precise, personalized medicine, care that's safe from errors, and care that's also much more efficient. So the public work that puts standards in place creates a marketplace for really exciting new entrepreneurial activities in care delivery and also the business of healthcare as we move from fee-for-service to fee-for-value.
New models of care are rapidly emerging, delivery system and payment reforms. And all of these reforms require information to flow electronically across primary care physicians, specialists, and hospitals. And unfortunately, very little of that exchange is happening today. So what we really need We're public and private sector leaders. Where we need them to collaborate and work together is to define the standards and policies for that flow, that health information exchange to occur in a way that builds trust and also has the buy-in and support of those who rely on those standards and policies.
Technology provides a laboratory where health policy can actually be experimented, tried in a small community with a small amount of money to see what might work in reforming healthcare. If we do that well, we'll create lots of little focus factory opportunities around the country to see what really can be done to improve both healthcare delivery and reduce the cost of care and improve the lives of all Americans.